Hello, I would like to talk a little bit now about vaginal itching and discharge during pregnancy. Obviously you do get different types of discharge in pregnancy, and that can be completely normal, but if you're getting sort of itchy thrush type symptoms, then obviously that's it's not good. It's very uncomfortable and painful, and irritating. So I do see quite a lot of women coming to see it. They might just mention it as an aside, or sometimes they do come for a treatment if maybe it's recurring thrush, and so basically they've already tried the creams and the pessaries which are available over the counter. Canesten isn't, the one that people normally use, and maybe they've used it, they've got rid of it, and it's come back again. So for acupuncture, it's really damp heat in the lower jiao, so we can treat it very effectively with acupuncture, and people do notice a significant improvement, but it's very, very responsive to diet as well. So this is where kind of the Western diet is not really doing us any favours. So it's basically can grow quite easily in response to too much sugar, too much wheat, too much dairy. So these are all things that I really advise women to cut out. So this is something that I'm familiar with because it did happen to me in one of my pregnancies, and I just had to stop eating bread completely, which is something that I really love, but I had to just totally give it up. And I really noticed if I was eating bread, if I was eating pasta, which I quite often make for my children because it's one of the things they all like to eat, then it would flare up again. So it's very, very responsive to your diet. You need to really go easy on kind of all yeast products, all wheat products, all dairy products, and you will get some relief. So it can also be a red flag later on in pregnancy for potential diabetes, although that it does get picked up very quickly nowadays, but it's just not nice, and you don't have to suffer with it. So mention it to your acupuncturist, or if you're getting recurrent bouts of it, definitely go and get a treatment, but you can also do a lot with your diet at home.